Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Accelerated Health TV and Radio Show. I'm your host, Sara Banta. I'm a health coach, natural supplement expert, and a busy mom of three. Make sure you hit the subscribe button below so you're notified every week with my new podcasts on Mondays and Tuesdays. And if you haven't already, join my free group coaching on Telegram with the link below. There is no downside. I teach you on a daily basis with tips and tools to enhance your health. I answer all of your questions, and you are going to be a part of a like-minded group to support you on your journey, in addition to truly taking control of your health. My goal is to reach everyone on earth with eyes to see and ears to hear my message of healing. So please help me with that goal and share this podcast with a few of your friends who may need my help, and they are going to want to listen to this one, as we have Dr. Amie Hornaman, a.k.a. the Thyroid-Fixer. She is my thyroid guru. Welcome, Amie. How are you today?
I am great, Sarah. I love being here. You know that. We have such great conversations.
I know, and I feel like more than ever before, people are paying attention to this stupid little thing called a thyroid, right, in the body, and they're going, unexplained weight gain, brain fog, I'm depressed, all of these symptoms, and yeah, my doctor says my thyroid's fine. But today we are going to get into understanding thyroid test results because, I mean, honestly, I was out to dinner with a good girlfriend of mine, working out like a fiend. She's hardly eating at our dinner, and she can't lose weight. She's actually gaining weight. And her doctor says, well, my thyroid labs, he says they're fine. I said, well, what did he test? And she doesn't even know, right? She doesn't know. But you just hear the words, my doctor says my thyroid's fine. Yep. So that's why I really wanted to get into this. There are so many, I think even doctors don't understand the thyroid test. And then there's also the fact that what's normal, right? What's the normal range on a blood test? So first, I want to get you to help us all understand the thyroid's role in the body and its importance for everything that's going on.
Yeah, absolutely. So the thyroid is the master gland. That's what's important to remember. And that is what gets quite overlooked in medical school. I mean, quite frankly, I think they could do a full year on the thyroid and just, touch the surface of it, really. The thyroid is the master gland. So it's controlling your metabolism. It's controlling your mitochondrial function and your ATP production. It's controlling your hair growth, your gut motility. So whether or not you poop every day, thyroid has control over that. It controls your heart rate, your blood pressure, your body temperature. So women who say, I'm cold all the time and everyone else is comfortable and normal, that's most likely your thyroid. It really has control over our entire body. So whenever we are, and even mood, so depression and anxiety is worth notating as well. So when we have those symptoms, we always have to look at the thyroid first, because if you're looking at anything else, that's where people get Band-Aids, right? That's where we get the antidepressants and the sleeping pills and the laxatives and the heart medication, the blood pressure medication. They're all Band-Aids to where if we just went back to that master gland and optimized it, we probably wouldn't need the majority of the medication that we're on.
Absolutely. I mean, I talked about, I believe it was on your podcast and a couple other times as well, that most people, when they optimize their thyroid, they got off their antidepressants, right? And I personally feel when my thyroid's optimized, I'm pooping like magic, right? It's going. But then when everything is slow in the body and the metabolism is slow, well, of course your bowels are going to be sluggish. everything's sluggish. Your brain's sluggish. Your hair growth is sluggish. Everything. I even notice my vision goes blurry when my thyroid is sluggish, and my vision is on point when my thyroid's optimized. It truly is the master endocrine gland. I also want to really emphasize the importance of the thyroid to the adrenals, because so many people complain about adrenal burnout, especially perimenopause and menopausal women. Can you just discuss the adrenal factor as well?
So the adrenal glands sit on your kidneys and they produce cortisol. So, you hear a lot of people say, like you said, Sarah, adrenal burnout, adrenal fatigue, but essentially that cortisol production is essential for life. We don't want too much and we don't want too little. And there's a correlation between cortisol and T3. So where T3 needs cortisol, if you don't have enough, you're not going to produce enough T3, and that T3 that you do produce, or that maybe we give you in the form of thyroid hormone replacement, you're going to be really sensitive to it. So you're going to feel more anxious and agitated and jittery. Whereas the opposite too, cortisol needs T3. So people who are really low cortisol, we give T3 spaced down in intervals through the day, and we can actually have an effect on the adrenal glands to produce that cortisol that we need for life. So it's all about finding that balance with the adrenals and really looking at both the thyroid and the adrenals, and of course sex hormones and everything else that we tie in, right? But really looking at the thyroid and the adrenals because they play together.
So you could be taking the medication for two separate people with two separate profiles on cortisol and have very different reactions. Is that what that's what you're saying?
Yeah.
So
yeah, absolutely.
So, okay. So now I want to go through the thyroid tests. Most doctors literally go just with the TSH, but I want to emphasize that all of you out there, if you're not feeling right, whether it's just a mood disorder or whether it's your gut, whatever it is, you demand a full thyroid panel. So let's go through what a full thyroid panel looks like and talk through each one of them, the TSH, T3, all of the different factors.
Absolutely. So I'm sure if you've been listening to this, Sara has mentioned in the past, and I know her and I have talked about this before, that standard lab value range that you see on your labs is not something to even look at. I mean, quite honestly, we're going to give you some tips and some optimal ranges where you might glance at that range, such as the free T3, upper quadrant, something like that. But those standard lab value ranges were taken from groups of sick people. And basically, to get those lab value ranges, they test everybody. They don't weed out the person that's 100 pounds overweight, the one that's has diabetes and heart disease. They are taken from a large section of people eating the standard American diet. What functional medicine does is we say, you know what, give us your fit and you're healthy, those badass people that are 60 years old and look like rock stars. Let's test them because obviously they're optimized. No disease states. They're not on Band-Aid medications. They feel great. They look great. They perform great on a daily basis. Let's test them to get what that optimal range is. So it's really important when we're talking about these tests to remember that I'm going to talk about optimal ranges, not falling into this big, huge, wide standard lab value range that you see on your labs. When we start with thyroid, we start with TSH. You're always going to get that. You go to your doctor, you say, I want my thyroid tested. They're going to test TSH. That's a no-brainer. But even in that test, that standard lab value range goes up to a 4.5. Functional medicine wants it below a 2. So right there we see, okay, there's a discrepancy of conventional medicine versus functional. We like much more narrow range. And in that TSH, I don't even care if you're suppressed. I don't care if you're below a 1. That does not mean that you're hyper ER, as in, hyped up, crazy. Your thyroid is producing too much thyroid hormone. I don't care about that. I want that TSH below 2. Then we move on to free T4 and free T3, which those are testing the unbound forms of the 2 thyroid hormones. T4 is inactive, T3 is active. Honestly, at the end of the day, I don't care about the free T4 as much. I don't want it in the toilet. I'd like it around a 1, 1.2. If it's too high, that kind of flags me that you're either making too much T4, or you're given too much T4 in the form of thyroid replacement. So these are the people that I know you're listening. You're on Levo, you're on Synthroid. That is it. Your doctor gave you some T4 pills and said, this is all you need for your thyroid. You'll be fine. So if that T4 is too high, that's a red flag for me that you're on too much T4 medication. And I bet they're not testing your reverse T3. So hold on to your pants. We'll get there. Free T3 is the active thyroid hormone. That's really important. This one is the one that I really focus on. I want that in the upper quadrant of the range. So we used to say 3.5 or above because most labs would kind of roll in. If you came in at 3.5, you were in that upper quadrant. LabCorp has thrown a wrench in that. They have a lab value range that goes all the way up to 4.4. So now I just say, I want you in that upper quadrant of the range. Or if you're listening in a different country, upper quadrant of that range. So that's where you will look at the standard lab value range, but you want to be in the upper quadrant of it. Reverse T3 is your anti-thyroid hormone. I use the analogy of a bouncer at the club. The bouncer is outside of your cell door, not allowing that beautiful active T3 thyroid hormone to attach to the receptor site of the cell. So too much reverse T3 is a problem. And in functional medicine, we want it less than 12. Now that range goes all the way up to a 24. So I have had patients come in with a reverse T3 of a 20, of a 22, and they're told that they're normal. But it's important to remember what reverse T3 does in the body. Reverse T3 is a beautiful survival mechanism that was built into us. So when you are in the ICU or the ER, you're in a traumatized state, you're pregnant, you don't need to be burning body fat. You don't need a high metabolism. You don't need to, well, pregnancy aside, if you're laying in the ICU or the ER, you really don't need to be growing your hair or feeling that great. You just need to survive. So it will go up in those times of stress and trauma to protect the body. It's built into us for a reason. The problem is when we give you too much T4, so now I'm coming back to all my peeps out there on T4 only, we give you too much T4, and that's what doctors will do. Here, have more. Let's increase your dose. Let's bring you up again. Let's increase your dose. All that T4 will push over to reverse T3. Now you have too much reverse T3, and you're like, I'm on so much thyroid hormone, and I feel like garbage. Well, yeah, that's because your doctor keeps dumping on that T4 medication, and you're pushing it over into the anti-thyroid hormone, reverse T3. Really important to look at that. Vital to test it. Do not let your doctor tell you that it's only tested in a clinical setting, because that's wrong. We want to test it because here's the thing. If you're walking around trying to live life, I don't want you in survival mode. I don't want your body thinking that you're laying in the ICU. I want you vital and happy and energized and living your best life. So we have to test that. And then we test the two thyroid hormones, TPO and TGA. Those are tests for Hashimoto's. We want to see if you have the autoimmune form of hypothyroidism. And any antibody is an antibody. I always use the analogy of soldiers. So when we're talking about any kind of autoimmune condition, you have those soldiers that go out and they attack whatever body part is in the autoimmune realm. So in the case of Hashimoto's, it's the thyroid gland. Those soldiers go out and they attack your thyroid and they beat it up and they whittle it down to nothing. So it can no longer produce T4 and T3 properly. If you have 5 soldiers or if you have 35 soldiers, it makes a little bit of a difference. Yeah, you have more of an army with 35 or 100 or 1,000. But even if you have 5, that army is going to grow. If you have 5 soldiers, it's time to look at that and say, hey, there's something going on here. You are building up immunity to your own thyroid gland. Why don't we stop it now before it progresses and before it builds up to 100 or 1,000 and before you're 50 pounds heavier and laying on the couch and you can't get up? Let's address it now. So that's those are all of the thyroid tests that I like to see. There are some that you might see on there, like the total T4 and T3. You might see T3 uptake. Not as important when we're really kind of whittling it down for you to understand it, for you to be able to write this down and get all the tests. Those are the top ones.
Okay, so many questions. So number one, Can you name the T4 medications that are out there that people are on so that they can identify what they're on? And with that question, is that to say that when the doctor, if you don't feel great, you go to your doctor, they increase the T4 medication and you will actually feel worse? That is the clue that things are going to reverse T3. Is that correct?
Yes. So the T4 medications, you're going to have your levothyroxine, that's the generic, Synthroid brand, and then Tirosint is another brand. So those are that falls into the T4 category. Levoxyl is another one. There's a couple over in Europe. I'm forgetting their, I think Euthyrox or something, but those are just T4 only. And just like Sara said, as your doctor keeps increasing it, because you go to your doctor like, hey, I can't lose weight. I'm really tired all the time. My hair is falling out. Oh, here's some more T4. Let's increase your thyroid medication. Or they'll do something wacky like, let's increase it on Saturday and Sunday and keep it the same through the week. It doesn't matter. You're still increasing your T4. And if they're not testing reverse T3, that's a problem. And if you increase your T4 medication and you feel worse, that is a problem. So that's a kind of a signal to you to say, yeah, you should probably look at that reverse T3 because you might not be converting properly. T4 has to convert to T3 to become active. There's not a single receptor site on your cell for T4, not one. It has to convert and become T3 in order for it to become active. So if you think about it, we're giving you all this inactive thyroid hormone. And yes, the body is built to convert, but it doesn't always convert well. And not everybody converts well. Some people have issues converting. So that's where we have to look at that reverse T3.
In my experience, most people taking a T4 medication don't get results. In your experience, what percentage of people would you guess on T4 medication is actually successful?
I have a stat. We actually have stats for this. It's 2%. 2% do well on T4 only. 98% do their best on T4 and T3.
So there you go, guys. I mean, what are the chances that you are one of the 2%? Okay, so as far as the antibodies go, I understand nature's survival mechanism in creating reverse T3 in the body, right? Survival, we might face a famine, we're being chased by a tiger, whatever it is, we're needing to fight off a virus, all of these things. What is the purpose of any antibody in the body? What's the body's reason for having that?
There really is none. I mean, when you think about all the autoimmune conditions, they're kind of detrimental to the body. They break it down. So there's not really it's kind of like saying, what's the purpose of cancer? Like there is none. It's just something in the body that's off. It's the body that is confused. It's our own immune system that's confused. And our immune system, just like our immune system is built to protect us from true invaders, from true pathogens and toxins, it does go awry at times and it starts to build up an immunity to a particular body part. So in the case of MS, horrific autoimmune disease, the body is attacking the brain and the spinal cord and producing lesions on the brain and the spinal cord. And, the person has very unfortunate side effects from that, very unfortunate symptoms. In the case of Hashimoto's, the body is just seeing the thyroid gland as something odd, something bad, something different. And that's why in the case of Hashimoto's, we tell people, please do not eat gluten because gluten looks like in chemical structure, it looks like the thyroid gland. So if you have these soldiers that are all amped up and they're ready for war for anything that appears to be the thyroid gland because they think the thyroid's a bad guy and you eat gluten, they're going to launch an attack. So it's the same. I mean, it's with all autoimmune conditions, we need to support the immune system and calm things down in the body so the body can feel safe and supported and it doesn't feel like it has to go out and attack itself, essentially.
Right. I liken it to when you get food poisoning, for instance, on a piece of fish. The fish is fine, right? You're fine eating fish, but you get sick off of fish. You probably want to abstain from from any fish for a couple weeks because your body doesn't trust you, and you need to calm it down, calm the nerves down, get everything back to, okay, I'm feeling good, and trusting you again to act normally. So I want to now look at your blood test examples, because I think it's really helpful to actually look at what a blood test looks like and what the ranges look like. I mean, I know I'm a visual learner, and I think it will help everybody else.
Definitely. So I have my own pulled up. I mean, obviously we can go through all kinds of scenarios in terms of what I see in my patients, but I have just some of my own pulled up that we can look at. And I will tell you that I personally am on T3 only. So I'm going to be a little bit of a different case than most of you are used to, or maybe most of you are used to seeing. But this is also, it's going to be a good example for anyone on any kind of T3, because we're going to talk about a couple of patterns that we're going to see in your labs that could potentially throw off your doctor, we'll say, that can, make your doctor think that you are hyper, but you're not. So yeah, let's do this here. Okay. So are you able to see my Quest labs here?
Yep. There we go.
Beautiful. Okay. So, yep, I got a lipid panel. Yes, I'm flagged high. Don't care. That's totally healthy. If you do happen to be flagged high in your lipids, and I know this isn't a lipid conversation, but so many of you might look at it and go, oh my gosh, wait, she's flagged. She's red.
Well,
Again,
no, I would love to talk through that, because this is a big issue right now. A lot of cholesterol levels are increasing on their own because of the spike protein. We're seeing that, but I'm flagged high as well. So why don't you talk through that really quickly?
So first of all, the total cholesterol, that used to go up to 300, and you were not even flagged until you crested 300, which honestly in functional medicine, we don't care if you're 400 total cholesterol. You need cholesterol for every function in the body. Every cell has a lipid layer, meaning a fat cholesterol-based layer. And your hormones, your sex hormones, need cholesterol to build upon. They need that as a building block. So the last thing we want to do is lower cholesterol too low. Actually, get a little bit higher. My HDL, yes, it's flagged low, but I feel pretty confident in all the healthy fats that I eat, so I'm not going to worry about that at all. And I'm certainly not going to worry about the LDL being high, because we know that now we know, well, at least in functional medicine, probably not conventional, that the higher your LDL, the lower risk mortality that you have. So it's actually healthier to have a little bit higher of an LDL than it is to have a low LDL. You want me to keep going down that rabbit hole or move on a little bit?
It's funny, as I always say, that a lot of people that are put on statins are usually also put on Viagra. And there's a reason, because you need cholesterol for your testosterone and for your hormones. So there you go.
Well, I always say this is why we're seeing the demasculinization of America, because how many men are on statins? How many men are walking around with bellies and dad bods that are being celebrated, and they're put on statins and they literally have no testosterone. They don't have, and then they're not even educated that their testosterone should be XYZ. So they're walking around literally like with man boobs, and they think that that's totally normal.
Yep.
Yeah.
And we can get into that. We'll talk about the hormone fixer in a minute, but it's a pandemic. I mean, the amount of kids, because I have young kids and they're in 19, 20 years old, and that population, it's not the boys that I grew up with, right? There's definitely a demasculinity that's going on.
Yep. Yeah. No, there definitely is. There is. Now, please remember, like when I started talking about this, I am on T3 only. And this is where I say in the beginning, I don't care if your TSH is low. I really don't. Whenever you're taking T3, I don't care if you're on 5 micrograms, 10 micrograms, if you're on NDT, which is Armour thyroid, or NP thyroid, that contains T3. Now, I mean, you could even be on a high amount of T4. You could even be on a high amount of Synthroid, and that is going to push your TSH down. It's going to make it suppress, just like this, just like you see. My TSH is suppressed because of that T3. T3 is very powerful at suppressing TSH levels. Now, where we really want this is post-cancer, post-thyroid cancer. We want that TSH to be suppressed, to be low like this. Now, I did not have thyroid cancer. Mine is just low and suppressed because I am on T3. And you can see if I do, and over time, it's never been high. It's always been suppressed because I've been on T3 monotherapy for about 15 years now. So it's never going to come up and all of a sudden be magnificent and amazing. It's always going to be low like that. Moving on to my total T4. Now here's where, again, you have to take it person by person. They did total and not the free. The free might be below. But the total T4 is not registering, but I don't take T4. I don't expect it to register as anything because I'm only on T3. And again, the problem would come if this was high. If this was high, then I would absolutely be worried about my reverse T3. I would be worried about too much T4 in my system and in my body.
So is your body, when you're on free T3, it will shut down any production that it may have been doing of the T4 and T3. Is that correct?
Yes. Okay. Yeah. Let's unpack that a little bit. Number one, if you have Hashimoto's and you're in the latter stages, you're in the end stages of Hashimoto's, it is absolutely probable that your T4 will drop down low. So will your T3, because remember that thyroid gland is being beat up and shrunk down, and it literally can't produce those hormones anymore. In the case of, now I don't know what stage of Hashimoto's I'm in. I don't even register antibodies, but I know that I have it. But I'm also, I live a healthy lifestyle. I'm gluten-free, so I may not register antibodies ever. In the case of taking thyroid hormone, specifically taking something with T3 in it, it is going to downregulate your own thyroid production. So again, someone might look at this, an endocrinologist might look at this and say, "Oh my gosh, you have no T4. What? No, you're hyper because you have a low TSH and your free T4 is low. And this isn't right. You're on too much T3 medication. We need to drop T3 medication because we got to get that TSH up." And they're not understanding that natural feedback loop that occurs. Yes, I am on T3 only, but I take enough to support my body. I feel great. I feel optimized. I have not a complaint in the world. I don't care that it downregulated my own T4 production. I don't care because I was running around with a high reverse T3 anyways. So it doesn't matter. I mean, my thyroid gland is crapping the bed on its own. So what do I care whether it shuts down that very little that it's producing anyways? It doesn't matter. It doesn't matter. So again, my labs are going to be a little bit different, but I also see these in patients when we put them on Armour thyroid, or when we bring in that much needed beautiful thyroid hormone T3 and pair it up with their T4 medication. It just works really well together. And then we'll see that suppression in the T4.
So yes, will you talk about Armour and what that is versus just the T4 medication? I want to make sure that people can decipher what medication is what.
Yeah, definitely. So Armour thyroid is T4 and T3 combined. Whenever we're talking about Armour thyroid, or we're talking about NP, any kind of natural desiccated thyroid medication, NDT, it is T4 and T3 combined. So it's about 80% T4 and about 20% T3 because they're trying to mimic your own thyroid gland's production. So that's why we dry the thyroid gland out of a pig, because pigs are very close to us in structure, especially with the thyroid gland. And we dry their thyroid gland out, desiccate it, hence the NDT, and then we can get that T4 and T3 powder medication out of it. So it's 80% T4 and 20% T3. Now,
And
for me, Sarah, yeah, go ahead.
do you like to put people on that indefinitely, or do you like to get them on and get it off? Because there's a lot of practitioners out there that believe that you should not be on it long term.
Here's the thing. It depends where you're at in your journey. If your thyroid gland is in the toilet, it's half gone with Hashimoto's, you need to replace those hormones that are no longer being properly made. You just do. I mean, there's no bringing your thyroid gland back if it's half gone, if it's destroyed. So it'd be the same as if you have a type 1 diabetic that you have to put on insulin because their pancreas no longer produces proper amounts of insulin. There's no point in time in their life that they're ever not going to need insulin. The pancreas, done, not producing enough insulin. We need insulin to survive. So for a person to say, oh yeah, but I really just don't want to be on medication the rest of my life. Well, then it's like, then you're not going to have a long life because you need that hormone to survive. Now, will you die without thyroid hormone? Eventually, but not quickly. But you're not going to live a good life without it. So it's kind of finding where someone's at in their journey. If they're in the very beginning, and I've had patients like this. They're in the very beginning. Oh, I wish I could pull up their labs. I would need their permission, but I've had patients like this just the other day where it's like, oh, you're right at that border. You're right at that border. So like we said, the reverse T3 needs to be below a 12. You're at an 11. The free T3 needs to be 3.5 or above in the upper quadrant of the range. You're at a 3.5 or a 3.4. You have 10 antibodies. They're right at that cusp where I can actually have the conversation with them and say, what do you want to do? Because I think we can do this without medication. I really think that we can use iodine. We can support your thyroid. Make sure your mag is good. Eat some Brazil nuts every day for your selenium. Maybe use a bioregulator. Maybe use a glandular. Maybe use T2. But we might be able to keep you off medication. And a lot of people want to do that because they don't want to get in that loop of getting on and then not being able to get off. The problem with practitioners that start someone on Armour and then go off, you can still shut down that feedback. Sometimes it'll work. Sometimes it'll work just enough to help with the symptoms, and then they get over that hump. And then sometimes they can actually shut down the thyroid gland. So now you're going to be on medication the rest of your life.
Right. What does it look like? What does a test look like if someone has had their thyroid taken out?
Yeah. I wish I could find it. So I haven't had it taken out, but I did a test one time withholding my medication for much longer than 18 to 24-hour recommended. So I do have one test. The latest test is when I was playing around with what my test would look like, because I know this wasn't going to my normal doctor. This was like more for me and the practitioners that I work with. So we can kind of around with this. I don't recommend doing this if you're working with a normal doctor. Let me show you my free T3. I know you're seeing some meds. Please don't worry about me. I'm good. Here's my free T3 when I took my medication the morning of my lab. So this is why we tell you guys, don't take your meds before your labs. I'm actually flagged high, like I'm above a 20. Like they can't even detect how much T3 I have in my body because I literally took it 2 hours or 3 hours before I went to go get these labs done. I wanted to see where I landed. Now, if I do an overtime, this will probably show the point in time in which I did not, right here, this 1.7, that's when I went about 36 hours with no medication. So what this told me was that if I do not take medication, I'm pretty much the same as a total thyroidectomy patient. My
Wow.
thyroid gland, if it is still there, it's not producing anything on its own. Like it's spitting out very little. And this might have even been residual from my medication, you know?
Right.
So yeah, without a thyroid gland, you have to, like, you have no choice. You will eventually die without thyroid hormone because it does control everything. It just does.
Okay.
Yeah.
So back to the original, we were scrolling down. I believe you were at DHEA and something else.
Yeah, let me go back to my lab. So my testosterone is not where I would want it to be for women. Simply because, again, I am experimenting on myself. I am actually doing the Wiley protocol, rhythmic dosing. So when you do that with estrogen and progesterone with female hormones, ladies, that is literally inducing a period to bring it back after you're in menopause. I'm playing around with it to see how I like that versus static dosing of hormones. My testosterone is low because I've been off my beautiful testosterone, and I've been feeling okay. It's been okay. I have snuck in a testosterone shot here and there. But let me get down here.
And why did you stop your testosterone?
There are very few trained Wiley protocol rhythmic dosing practitioners out there. But when you work with them, they are all taught that until we induce that period, you are not allowed to take testosterone. So I'm like, oh, okay. So I did. I went off. I'm like, listen, if I'm going to do this, I'm going to do it right. I'm going to listen. I'm going to listen and do it right. But this is my testosterone off of testosterone. This is too low. And if you notice, the reference range only goes up to 45. I want my ladies at 50 or above. Now, most women do really, really well, like 100 to 200. I can show you an old lab when I did. Well, maybe I can go over time here. When I was on testosterone, and I mean, it kind of hit a level that would raise some eyebrows with a conventional medicine doctor because I do injectable testosterone. So here, this is like 377 is when I tested, when I was doing my testosterone injections. And then if we go down here, this is prior to me getting on testosterone. I was at 33. And really the crazy thing is when I start looking back historically, I've been low without symptoms. So even at a 25 and at 22, I really did not have symptoms until the last couple of years. It hit me because I was transitioning into menopause. So that's when I find that it hits women the hardest, is when they're going into that perimenopause, menopause state. And that's when you really start to feel the low testosterone. The symptoms come on, the libido drops, the vaginal dryness starts, the weight gain sets in, you start to lose muscle mass, you lose motivation at the gym. So yeah, I would say I felt great here with no androgenic symptoms at a 360, 370. I would like to get back there after I'm through the trial phase of this Wiley protocol.
Wow, that's risky.
I know, right? I know. Sarah's like, I'm not giving up my testosterone.
I mean, I don't take testosterone, but I've always had a healthy amount of testosterone. I've suffered from PCOS, so it was the opposite problem for me. I love your hormone fixer. I stay on that daily and I feel great. But I can also tell that when my thyroid is working and optimized, my testosterone is up too. I mean, they go hand in hand usually. Yeah. So that it's really interesting with what you're going through. I can't wait to hear how it all plays out.
Yeah.
So,
yeah.
Okay.
And then obviously my free testosterone full total. And this is why when we say to test the total is more important, because you can see the correlation. If you don't have enough total, you're not going to have enough free. So you might as well just make sure you test the total testosterone and really focus on that. And that's where we can say with confidence to all women out there your total should be at 50 or above. Men, your total should be at 800 or above, period, across the board. So if you don't have enough total, you're not going to have enough free.
Right. And I want to get into some supplements. So we might as well talk about the hormone fixer and the bedroom fixer right now as it relates to testosterone, because this is something, my husband's 53. He's not getting the benefit from his workouts and his clean eating like he used to. And so can you explain how the bedroom fixer and the hormone fixer address these issues?
Definitely. So did I have, I don't know. I don't think I had an SABG tested, or if it is, I would have to dig through. I know the last time I had mine tested, it was a little bit elevated, where my SHBG was high. That was the same time I had that high testosterone. My DHT was high, my SHBG was high, my testosterone was high. Well, the reason why I didn't feel androgenic, meaning I didn't break out, I wasn't growing facial hair, I didn't have the high testosterone androgenic symptoms, was because my SHBG was binding to a lot of that testosterone. The problem with having high SHBG is it's going to bind to your testosterone, to your estradiol, and to your T3. Now, we just got done saying free T3, that's the most important active thyroid hormone. Last thing you want it to be doing is bound to a train, not able to get off the train and get to cell. And that's essentially what sex hormone binding globulin is. It's a little train that your hormone's attached to and just kind of ride around your body. And the train's trying to get to the cell, but the train is so sticky, high SHBG, that the hormones can't get off the train. So we have to end up giving more hormones, higher doses, to overcome that SHBG being elevated. Or we add in bedroom fixer, formerly known as SHBG fixer, but since nobody knew what SHBG was, we changed the name, because essentially when you take bedroom fixer, you lower your SHBG, you get more testosterone. So what does that equal? Better libido, sex drive, better erections for guys. What about when we release some of that estradiol, ladies? Vaginal lubrication. No pain during intercourse like you're getting now with low estradiol. And then there's the T3. So when we release that T3, you get the benefits of everything, since the thyroid's the master gland. So now you have more energy, you have more drive, you have more of everything in your body when you release those hormones. Now here's the catch. I want everybody to remember this. When you are taking, like Sara and I, well, I don't think you're on estradiol yet, Sara. Well, you're not on testosterone yet. Okay, I'll use myself. When I'm in my regular program, taking testosterone, estradiol, and T3, those three things push up your SHBG. Now, am I going to give them up? No, I'm going to take bedroom fixer to put the cap on it. So as I'm doing the very things that will make SHBG rise, and I know it sounds kind of counterintuitive, like, wait a minute, you're taking all these fantastic hormones and that's going to push up the sticky train? Yes, it does. But here's the thing. What we do is we cap it. So we bring in bedroom fixer to keep it from going to 200, where it's a hugely sticky train and I'm not getting any of the hormones. So we bring in bedroom fixer to cap it. And then we do the lifestyle things. Make sure your calories aren't too low. Make sure you are getting in enough protein. Sara talks about this all the time. Make sure you're getting in enough animal-based protein, because those amino acids keep that SHBG from rising as well. So you can do the behavioral things, and then you can do the supplemental things, and then it all just works together. So you might not ever push your SHBG down to a 60, but it might keep it from going to 200.
Yeah. And I will let you know that with my husband, testosterone was in the 800 range, but too much estrogen. And so we incorporated the bedroom fixer, and it definitely brought down the estrogen. We also bound it up. We also took calcium D-glucarate, which was binding up the excess estrogen. And I do the hormone fixture every day to help boost my female testosterone. I love it. It's part of my protocol to get me out of bed. And I do that with the Acceleradine. I can't believe we're almost out of time, Amie. I mean, we need like hours.
We do. We just do.
But with regardless of who you are listening, thyroid, no thyroid, antibodies, on medication, not, I think Amie and I both agree the Acceleradine iodine is needed because you need the iodine for the T4 and T3, and it's the only kind that is monoatomic and has 100% bioavailability, where your thyroid and your metabolism is so tired already to ask it to work hard to break apart molecules from iodine from potassium or whatever combination there is in a different type of iodine supplement is difficult. So most iodine supplements are only 10 to 20% bioavailable, and they come from radiation sources. So that's something really to think about. And the Acceleradine, like all the accelerated health products, is enhanced with the scalar frequencies. And this one is to detox the brain from radiation and heavy metals. And that's why people think, oh my gosh, my brain just woke up. The brain fog's gone. The anxiety goes away. But you use that, and you also can throw in the Thyroid-Fixer, which we didn't talk about, the T2. Do you want to just take a 30-second, explanation of what T2 is?
Yeah, absolutely. So Thyroid-Fixer contains T2, which is a thyroid hormone, but it's not going to skew your lab values and make you look hyper. It is going to increase your basal metabolic rate. So the amount of fat that you're burning at rest, it's going to increase that. It's going to increase ATP production. So you get the weight loss and the energy production. Even if you are one of those that are stuck on T4 only, like we talked about, that 2% that you're stuck on T4 only, you're not doing too well, you can take Thyroid-Fixer. And then, Sara, I had someone in my group the other day talk about the Acceleradine and pairing that up with Thyroid-Fixer. She said, literally, like, you cannot pry those two supplements out of my hands. Those are what made the difference. She's like, those two supplements alone made such a difference in her body.
That's what I'm hearing from everybody. And that's why I've done the accelerated thyroid pack, which is the Acceleradine, the Thyroid-Fixer, and the accelerated thyroid together as one. And people their lives are changing off their antidepressants, some are off their thyroid medications. I've had people say their Hashimoto's has reversed. So all of these things. And, you add in the accelerated keto, which is enhanced with frequencies to cleanse the liver and clear emotional and physical shock from the body. It's all just kind of working together, and it's like this domino effect, right? So anyway, I can't believe we're out of time. Amie, thank you so much for coming on. And you all can find the bedroom fixer, hormone fixer, and the thyroid fixer at Accelerated Health Products. And Amie, will you tell everybody about your podcast and where they can find you?
Absolutely. So go search for the Thyroid-Fixer podcast on all podcast platforms. Sara has been a guest many times. We have amazing conversations. And then you can also, if you're on Facebook, you can join my Girl Fix Your Thyroid Facebook group that is open to the public. And in there, you can even post labs. You can ask me questions. You can go directly to my website at dramihornaman.com as well to find more stuff there. But definitely check out the podcast because you'll get a ton of information and you'll be able to hear me and Sara chat more.
Yes. And I don't carry very many other brand supplements, and Amy's are amazing. And I take them all, you guys. I take them all. So I am walking the walk. So thank you, Amie. And thanks everyone else for joining us today. If I can help you with your health issues, you can contact me directly through the website, sarabantahealth.com. Happy to put together a protocol for you. And join the free group coaching below with the Telegram link. I teach you on a daily basis with tips and tools to enhance your health. And you will be a part of amazing group of people to support you on your journey, in addition to truly taking control of your health. You can follow me on Facebook and Instagram under Accelerated Health Products, and across over 100 channels under Accelerated Health TV and radio show. And my goal, as I mentioned, is to reach everyone on earth with eyes to see and ears to hear my message of healing. So please help me with that goal. Share this podcast with a few of your friends who may need my help. Everybody is suffering from suboptimal thyroid issues, so this is one to definitely share. Join us every week on Mondays at 2 p.m. Pacific, Tuesdays at 1 p.m. Pacific, and you can use coupon WELCOME10 for 10% off site-wide. Thanks again for joining us here, and have a great week.